There's a growing body of research on the efficacy of using the psychoactive drug psilocybin to give relief to patients suffering from treatment-resistant depression. To begin the discussion of this research, I will give a brief overview of clinical depression and its potential causes. Depression can be described as a mental health disorder characterized by persistently depressed mood or loss of interest in activities, causing impairment in daily life. The National Institute of Mental Health says that if you experience any of the following symptoms consistently for more than 2 weeks, it can be considered depression. This is especially important now considering recent reports have shown that rates of depression in the US have tripled during the COVID-19 pandemic. We don't know exactly why depression happens, but the prevailing theory is called the monoamine hypothesis, and it states that depression occurs when a person is lacking in serotonin, norepinephrine, or dopamine. This hypothesis is backed up by the fact that many current antidepressants are reuptake inhibitors for these neurotransmitters. That means that they work by blocking the reuptake of these compounds by the presynaptic cell, causing a higher volume of the compounds to be in the synaptic cleft at any given time. It seems pretty clear then that if increasing the effective amount of a neurotransmitter relieves depression symptoms, then there must be a neurotransmitter deficiency, right? Well, neurotransmitters are used rather broadly across the brain, which means that while these drugs may relieve symptoms for some, they can also lead to the many side effects that we see with antidepressants. So let's try to get a little more specific by looking at some regions of the brain that have been linked to depression. One multi-region network of the brain that's been linked to depression is called the default mode network. The default mode network is known for its activity in many higher order brain functions. A few that seem especially salient with respect to depression are its activity in self-referral, or referring to the traits and descriptions of oneself, and its activity in reflecting on one's own emotional state. Specifically in this network, increased connectivity between the posterior cingulate cortex, seen here, and the medial prefrontal cortex, as well as the posterior cingulate cortex and Brodmann's area 25, have been linked to patients with depression. So what is psilocybin, and how does it fit in? Well, psilocybin is an agonist for the serotonin 5-HT2A receptor, meaning it binds and activates one of the same receptors that serotonin does. The compound is found naturally in some species of mushrooms and is most commonly known for being the active ingredient in psychedelic mushrooms. Some studies have shown that psilocybin can actually decrease connectivity between these regions of the default mode network that are linked to depression. In other words, the regions that are more highly connected in depressed patients become less connected after the use of psilocybin. But that's not all. When paired with therapy sessions, psilocybin seems to be effective at treating clinical depression. A 2016 study showed that patients experiencing depression that was resistant to classical antidepressants found significant reduction in their symptoms following 2 psilocybin-assisted therapy sessions. For 8 of the 12 participants treated, 1 week after their treatment, they even reduced their symptoms to the point that they wouldn't be considered depressed anymore. And for 5 of these patients at the 3-month checkup post-treatment, this reduction was consistent. A separate study in 2016 showed similar results up to 7 weeks post the initial dosage treatment. This study was on terminal cancer patients, and it also showed significant decrease in their anxiety levels, as well as their depression levels. In a 2020 follow-up to this last study, the same participants were retested 4.5 years after their treatment, and showed that the significant reduction in their symptoms in both anxiety and depression were consistent 4 years after their treatment, with still only those 2 initial doses. So what's the bottom line here? Well, it's certain that this treatment is providing relief to patients who have been suffering from depression. And while these initial clinical trials have small sample sizes, the results are incredibly promising. The treatment provides relief for 4 or more years after only 2 doses. Compare this with the current antidepressant treatments, which need to be taken daily, and this is clearly an improvement. What else do we know? Well, this treatment seems to be possible because of a drug that activates the same receptors as a neurotransmitter that is lacking in depressed patients. and that this drug may cause a decrease in connectivity between the brain regions that are over-connected in depressed patients. All that being said, the concept of this treatment is still extremely new, and research is still being done, so we don't have complete knowledge of the potential benefits or dangers of it yet. I would also like to say that the possession or cultivation of psilocybin mushrooms is currently illegal in the United States. Also, I do not recommend self-treating with this drug. All studies shown here are with trained professionals under physician supervision. That being said, I hope you learned something about this potential new treatment, and I thank you for your time.